I'm Dr. Jerry Hesch of the Hesch Institute in Aurora, Colorado. I'm a physical therapist, and my client Diane is a massage therapist. And how many years have you been getting osteopathic and chiropractic adjustments of C1?
About 30.
About 30 years?
Mm-hmm.
Okay. So this is already almost November 2018. In this year, how many adjustments have you had up there?
Wow, easily 2 a month.
Okay. So you've had 10 times, so you had 20 adjustments this year.
Yes.
Good. And what does it cost you each time?
Anywhere from $45 to $85, depending if I'm seeing my chiropractor or my osteopath.
Okay. Alrighty. So you spent more than $1,000 this year.
Mm-hmm.
Okay. Alrighty. So how you described feeling like C1 is forward in your throat, feeling like it affects your swallow.
Absolutely.
Okay. And any other symptoms? How do you know when you need to go get an adjustment?
I start getting occipital nerve headaches, and my jaw gets tight, and I can, if it's really bad, get vagus nerve symptoms of my feeling shaky or nervous inside my chest.
Very good. And have you ever been told that your C1 is hyperextended, that it's more forward, whether due to muscle or position?
I don't think so.
Okay. All right.
I would say no.
And you described an adjustment where it's done on the side, an impulse done on the side.
Well, that was 30 years ago when I first started getting it adjusted. Now they turn my head and pull.
Okay. Okay. So it's a rotational adjustment.
It's a rotational.
With some traction.
Correct.
All right. Okay. Well, what I'm suggesting is that you have had a hyperextended pattern at C1, and I don't think it's ever been addressed.
Okay.
And this is a bilateral pattern. Okay. The way that I encounter it is I evaluate traction in the front of the neck, where head and neck connect, and C1, C2 joints are more anterior, whereas C2, 3, and all the other joints are in the back of the neck. So the only way to evaluate these upper joints is to put traction on the front of the face and head up here. So the palm of my hand is on this part of your head and face. Mm-hmm. And what I do is I try and impart gentle traction, and I should, in a normal client, see movement of the whole body all the way down to the feet, and I don't get movement. This feels very, very rigid. Now I'm suggesting that C1 is forward a little bit, and I'm not saying it's displaced, I'm not saying it's even subluxed. It could be a muscular pattern that's rigidly entrenched, but it is at the forward end of its range. It's being maintained that way. Mm-hmm. So I'm going to drop your head back in extension, and so now the rest of your neck is an extension. C1 is also an extension, and so the rest of your neck is sort of catching up with it, so to speak. And now we have beautiful motion. Now when I do traction on that part of your body, I can see your feet move up and down. I can see movement in your abdomen. The whole body moves. This feels normal, but we can't have you walking around the planet looking up at the sky all the time. Right? If you cross the street, that could be a little dangerous.
Right.
Now, if we put you in flexion, just 15 degrees of flexion, the motion is blocked. So that affirms to me that it has an extension tendency. Okay? Now, when I come and I spring your mastoid, I have good motion. When I come underneath your mastoid and I side bend it, I have good motion. So it's not your OA joint. But when I come, I flex your neck a little bit, and I come on each transverse process of C1, and I'm trying to spring it to the right.
Oh, yes.
From the left to the right, it doesn't move well. From the right to the left, it doesn't move well. If I come underneath, I flex you a little bit and get underneath the transverse processes of C1, and I try and spring up towards the ceiling. It should rotate your head to the left. With a reasonable amount of force, it doesn't move. Doesn't move. Okay, so again, I'm suggesting that you have a hyperextension pattern of C1 on C2. So it's the second joint. It's not where your head connects to your neck, but it's the joint below that. Atlantoaxial joint is another name for it. And it's extremely simple to treat, and it's very easy to learn how to self-treat it. And so I look forward to working with you and addressing this pattern, and I feel like it's not well understood. That's my purpose of filming this, is to get the message out. And I feel like it's my biased opinion based on seeing people like yourself who have had an ample amount of rotational traction and side bending manipulations or adjustments, excuse me, and they still present with a bilateral restriction. And so my opinion is that a rotational side bending or traction manipulation on one side and then repeated on the other side doesn't get enough of a posterior symmetrical vector, nor does it impart traction to the C1, C2 joint adequately. And I think there's a lot of people like yourself who are not getting the core problem treated adequately. And I thank you very much for letting me film you, and we'll treat you and we'll film the results as well.
Okay.
Thanks so much.